I'm Dr. Hannah McLeod, and I've been a urologist here in Canada for over 30 years. Last month, a 72-year-old patient named James walked into my clinic in Vancouver. He told me he'd completely given up on intimacy because he just didn't trust his body anymore. 3 months later, he came back and said something I'll never forget. "Doc, I feel like I'm 50 again. My wife can't believe it. No pills, no surgery, just 3 minutes a day of an exercise most men have never even heard of." Now, here's what shocked me. A 2005 study published in BJU International followed men with mild to moderate erectile dysfunction. After just 6 months of targeted pelvic floor training, over 40% regained completely normal erectile function without changing their medication. Another 35% saw significant improvements in firmness, control, and satisfaction. That's 75% of men seeing real results. If you're over 60 and you've noticed changes in your size, firmness, or that upward angle you used to have, I'm here to tell you there's something you can do about it, eh? And I'm going to walk you through it step by step. Have you noticed changes in your size or firmness during intimacy? Have you quietly wondered if there's anything you can actually do? Maybe you've thought it's just hormones or aging, and there's nothing to be done. But here's what most guys don't realize. There's a powerful mechanical part of your body that you've probably never trained, even though it's essential for sexual performance. I'm talking about the hidden muscles of your pelvic floor. For the next few minutes, I'm going to explain exactly what's happening inside your body, why these changes occur after 60, and how a scientifically proven 3-minute daily routine can restore strength, control, and even confidence at any age. This isn't a gadget, a pill, or surgery. It's an approach that uses your body's own hidden muscles to naturally increase firmness, stability, and even how your size appears. Let me be straight with you. For many men, aging comes with a silent list of frustrations, erections that don't seem as strong anymore, an angle pointing downward that wasn't there before, an appearance that seems smaller. It's easy to blame hormones or think it's just getting older. But in reality, there's a mechanical part of your body that most men never train, even though it's absolutely critical for sexual performance. Inside your pelvis lies a network of deep supportive muscles known as the pelvic floor. Among them, 2 play a starring role in erection quality: the bulbocavernosus and the ischiocavernosus. Now, I know those are mouthfuls, so let me break it down for you in plain English. These muscles have one job during arousal. They trap blood inside the erectile chambers and keep it there under pressure. The bulbocavernosus compresses the base of the penis, squeezing the veins so blood can't escape. The ischiocavernosus reinforces that pressure, keeping the shaft upward and maintaining that upward angle men associate with youthful erections. When these muscles weaken through anesthesia, reduced activity, surgery, or simply not being used, blood escapes more quickly. The result, erections feel softer, fade faster, and lose that stable, elevated angle. This isn't just theory, folks. That randomized controlled trial I mentioned earlier from 2005 tracked men with light to moderate erectile dysfunction. After 6 months of targeted pelvic floor training, more than 40% regained normal erectile function without changing their medication, and 35% more saw significant improvement in firmness, control, and satisfaction. The reason is simple. Strong pelvic muscles improve something called venous occlusion. That's the internal valve system that keeps blood in the penis. With better closure, you get more pressure, more stability, and longer-lasting function. Now, after 60, several factors accelerate the decline of these pelvic muscles. Long periods of sitting can literally shut these muscles down. Surgeries like prostate removal can disrupt nerve signals. Natural age-related changes in coordination mean that even if the muscles are there, they might not activate at the right time. The consequences don't stop at firmness. Men often notice a downward angle, reduced responsiveness, and even an appearance that seems to shrink. This visual change is often misunderstood. The tissue length hasn't changed, but the loss of internal pressure makes it appear smaller. Here's the good news. You can retrain these muscles at any age. No gym equipment, no medications, and you can see improvements in just a few weeks. Let me be clear about something. Pelvic floor training doesn't increase anatomical length, but by increasing blood flow pressure, it completely fills the erectile chambers, creating a firmer, fuller appearance. There's also a neurological benefit. When you properly contract these muscles, you send stronger sensory signals to the brain. Men often report feeling more connected, more in control of the pace, and experiencing more pleasure during intimacy. This isn't just about performance, it's about restoring a sense of ownership over your body. All right, before you can train these muscles, you've got to find them first. The easiest way is during urination. Try gently stopping the flow midstream. The muscles you use to do that, without squeezing your legs, your abdomen, or holding your breath, are part of your pelvic floor. Do this only once as a test. Regularly stopping your urine can cause bladder problems. Once you've identified the sensation, you'll practice it away from the bathroom. Here's your basic routine. Find a comfortable position, either sitting or lying down. Take a few natural breaths to relax. Gently contract those pelvic floor muscles as if you're lifting something inside. Hold the contraction for 3 to 5 seconds. Release completely for another 5 seconds. This release is just as important as the squeeze. Repeat this cycle 10 times. Aim for 2 to 3 sets per day. You don't have to do them all at once. Spread them throughout your morning, afternoon, and evening. Now, during practice, watch out for common mistakes. Don't squeeze your thighs, buttocks, or abdomen. Don't hold your breath. Keep breathing normally. Don't push downward. The movement should be a gentle lift. Most men find they can integrate this into their daily routine without stress or discomfort. Even a few sets while watching hockey or reading the paper can make a difference. Remember, this isn't about brute force. You're training for control, coordination, and endurance, and the first improvements often come quietly. You might notice better muscle awareness, easier activation, or more endurance before you see visible changes. Let me tell you about another patient. Mr. Thompson, 65, came to see me frustrated. He was relying on pills before every intimate moment and was worried about side effects. We integrated a simple 3-minute routine into his mornings. 10 weeks later, he told me, for the first time in years, I felt in control. No pill, no planning, just me, confident again. That transformation wasn't magic, it was muscular. Hidden muscles he'd never trained before. Once you can isolate the muscles, the next step is neuromuscular control, teaching your brain to recruit them instantly when needed. Some men use biofeedback tools or guided apps to get real-time feedback on muscle activation. This can speed up progress, especially if you learn better by seeing or feeling direct feedback. Even without a device, you can practice quick rhythmic contractions to mimic what happens during arousal. Short squeezes followed by complete release train the muscles to respond rapidly, keeping you in control when it matters most. Here's what most men experience with consistent practice. Week 1 to 2, stronger awareness of the muscles, even if contractions are weak. Week 3 to 5, improved maintenance endurance, less effort to engage. Week 6 to 8, noticeable improvement in erection angle and stability, more control during intimacy. Week 10 to 12, fuller appearance, more firmness, and for many, renewed confidence, especially if blood flow was a limiting factor before. Pelvic floor training offers more than just sexual benefits, folks. It can improve bladder control, prostate support, and stability, and reduce the risk of pelvic organ prolapse. This approach is low risk, has no drug interactions, and can be done anywhere. For men who want to avoid medication dependence or who are experiencing side effects, it's a safe and effective starting point. As with any exercise, more isn't always better. Overtraining can cause tension or discomfort. If you experience pain, urinary changes, or anything unusual, consult a healthcare professional. For most men over 60, this is a safe, doctor-approved practice. But it's always wise to get clearance from your own physician before starting. Once basic contractions feel natural, you can add progressions to challenge the muscles further. Long holds. Gradually build from 5 seconds up to 10 seconds while maintaining complete control. Rapid pulsations. Practice 1 to 2 second contractions, then release. This builds reflexive strength for real-life moments. Functional practice. Engage the muscles during activities like climbing stairs, lifting heavy objects, or standing up from a chair so they activate automatically in daily life. These small improvements help bridge the gap between exercise and performance, making the improvements feel natural. Here's a bonus benefit. Men who keep their pelvic floor strong also notice better posture, less lower back tension, and more energy overall because these muscles are part of your body's core support system. Think beyond the next few months. Pelvic floor health supports better urinary control even decades from now. Protection against post-surgical complications if you need prostate treatment. Confidence in physical intimacy without the constant worry of losing firmness mid-moment. You're not just training for now, you're investing in quality of life for years to come. Performance issues can create a silent cycle of anxiety. The more you worry, the harder it becomes to perform, and the more the muscles lose their coordination. Training breaks that cycle. When you feel the difference in firmness, angle, and control, the mental weight lifts. And that confidence changes everything in the bedroom and beyond. Let's recap what we've covered today. Stronger pelvic floor muscles keep blood where it's needed longer, producing firmer, more stable erections. Better neuromuscular control means you can engage these muscles at the right time without thinking about it. A fuller appearance and improved sensation restore both physical and mental confidence. Secondary benefits include bladder control, prostate support, and reduced risk of injury. Every year you leave these muscles untrained, they get weaker. But start today, and in as little as a few weeks, you could feel changes that ripple through every part of your life. If what you've heard so far gives you hope, do me a favor and hit that like button, eh? It's a small gesture that helps more men discover practical, science-based solutions like this one. No shame, no guesswork. And if you found this helpful, subscribe to my channel so you don't miss the next video where we'll talk about something equally important, how your daily self-stimulation habits can affect your health, and when it's time to talk to a doctor. We'll explore how to keep that private habit safe, how to avoid hidden risks, and how to recognize the signs that your body needs professional attention. Look, I've spent over 30 years in this field, and I can tell you that most men suffer in silence when they don't have to. The tools are right there inside your own body. You just need to know how to use them. Comment below with a muscle emoji if you're going to try this routine. I read every single comment, and I'll answer your questions. And if you've already seen results from pelvic floor training, share your story. It might be exactly what another guy needs to hear today. Remember, this video is for educational purposes only and shouldn't replace medical advice. Always consult a qualified healthcare professional before making any changes to your health routine. I'm Dr. Hannah McLeod, and thanks for joining me on this important step toward better men's health. Take care of yourselves out there, and I'll see you in the next video.